Yes, greetings to you. Hopefully you're doing very well. I want to welcome you to HBMS TV Talking Health. So basically, this topic is always done live every Tuesday, and it is always a live sharing where people even send in their questions and they are answered. Our aim is to promote good health. So this program is repeated every Friday evening to make sure that those people who could have missed our program are part and partial of this. So this week we were able to discuss about understanding women infertility. So you who is out there, we just need to learn more about women infertility. And I also need to look at male infertility. That was our topic for this week. And before I get into our topical discussion for today, my name is Robert Semwez Masaka, the director HBMS TV. HBMS TV is home-based medical services television, a channel that is devoted to promoting good health. And our focus is you, the person who is out there, and you're ready to follow us. I want to send greetings to our sponsors, that is Mitiana Institute of Nursing and Midwifery. Thank you very much for making sure that these programs keep running. Then I also want to send greetings to Nasuna Community Nursing Home in Mitiana. I also want to send greetings to Masaka Home-Based Medical Services International. And thank you very much for making sure that these programs can keep running. And also, I want to say hi to the Real Estate Company. This is a company that is there to help you achieve your goals as far as real estate is concerned. So basically, in today's discussion, I want to briefly talk about understanding women infertility. So understanding women infertility, what is infertility? Infertility simply means not being able to get pregnant after at least 1 year of trying or 6 months of trying if a woman is over 35 years. I've seen very many people battling. And if a woman keeps having miscarriages, it is also called infertility as long as they cannot give birth. So where is the problem? You just know that the percentage increases with age. We have the subfertility, the sterility itself, then the cycle irregularity, and then the menopause. All these cases have ages that they set in. So you must be in position to know that age. And when you look at the causes of infertility in women, these causes could include age. You can talk about lifestyle, environmental factors, diseases, then talk about physical problems. Then you can also talk about hormonal imbalances. There are very many hormones, different hormones that manage one getting pregnant. So in case there is an imbalance, somebody can fail to get pregnant. Then we have when we talk about the hormonal imbalance, we talk about the female hormones in most cases, the estrogen, progesterone, and prolactin. The moment there is an imbalance of these hormones, just know there is a problem and you can even fail to get pregnant. Then I want to talk about the ovarian cysts. It is very common. And when you look there, you see a cyst in the ovary, then you can also look at the normal one. So in case you go for a checkup and find you have cysts, you need to do something about it. Then we can talk about the inflammation of the endometriosis. It's called endometriosis, other endometrium. The moment it is inflamed, there is a problem. So you also need to look for a solution. Then the other cause is fibroids. Fibroids these days are very common. I've seen people carrying fibroids to the extent that these fibroids are big to the extent of a child. So it is also a problem causing infertility. Then the other point, you can also talk about tubal blockage. Actually, this is also another cause of infertility. People have failed to conceive because of tubal blockage. But also on the other hand, we need to know that men also have contributing factors. For example, low sperm count, abnormal sperm production or function due to undescended testicles. It is very common. Then you can talk about the genetic defects or health problems such as diabetes, then infections such as chlamydia, gonorrhea, MAPS, or HIV. Then talk about enlarged veins in the testes. It results into varicocele. Also, it also affects the quality of sperm or even no release of sperm at all. Then the other factor, you also need to look at stress, anxiety of making someone pregnant, or fear of responsibility. It can also result into infertility. Then the other one, what are the causes of infertility in men? When we talk about causes of infertility in men, we talk about sperm abnormalities due to the following. You can talk about sexually transmitted diseases, talk about diabetes, talk about varicocele, talk about obesity, hormonal imbalance also in men, toxins or heat exposure, and then trauma, all these things. And now we even have what we call the risk factors. When we talk about the risk factors or the probable causes of infertility to both men and women, you can talk about stress. Then there's caffeine, excessive caffeine. Actually, you can talk about obesity, talk about alcohol, talk about smoking, talk about extreme exercise. It is good to exercise, but in one or the other, it can affect you. Then the other one is if you have these risk factors, you need to reach out and get professional help, not forgetting the environmental factors that negatively affect our health and cause free radical damage. At the end of the day, these things can also affect you and not be in position to give, but you can talk about processed foods, talk about medicinal side effects, talk about air pollution, talk about water pollution, talk about unhealthy lifestyles, and even stress, all these things. And now, what are the signs and symptoms? How do you know that you could be having infertility as a man or as a woman? You can talk about failure to conceive in women, irregular periods. The average woman cycle is 28 days long, not even 35, not 21. Anything from 20, apart from 28, just know there could be a problem. Then painful or heavy periods. Most women experience cramps actually with their periods. You can talk about no periods. It is common or uncommon for women to have an off month. It is very common, but the moment it is routine that you miss this and miss the next one, just know there is a problem. Then hormone symptoms of, you can talk about symptoms of hormonal fluctuations. Then talk about pain during sex, that is to the female. And then when we talk about men or the males, there is a problem with sexual function. For example, difficulty with ejaculation or small volumes of fluid that is ejaculated. Then reduced sexual desire or difficulty maintaining an erection. Then erectile dysfunction, talk about pain, swelling or lump in the testicle area, recurrent respiratory tract infections. Then you can even talk about low blood pressure. So what happens is that you also need to look at the medical management, but be concerned that the infertility treatment depends on the following factors: what causes the infertility, how long have you been infertile, your age and your partner's age, then personal preferences. But you also need to note that some causes of infertility cannot be corrected. These are medical interventions. You can talk about the laparoscopy for blocked fallopian tubes. There is the lescopy or the hysteroscopy. All these are done. Then I would advise you who is following us at HBMS TV that you need to consider the surgery and everything as a last option. You need to try out something. For example, I'll be sharing with you how to reverse infertility and get pregnant naturally. One of the things that you need to focus on, the natural management plus food supplements, is taking an antioxidant supplement every day or eating antioxidant-rich foods that will help you, that will help improve your fertility rates. Then you also need to consider eating more calories at breakfast and fewer at your evening meal. That it also improves fertility. Then the other one, avoid foods high in trans fats, avoid refined carbohydrates as they raise insulin levels, which may increase the risk of infertility and make it harder for you to get pregnant as a woman. Then the other one is eating more proteins from vegetable sources instead of animal sources. Then taking multivitamins, it also helps you boost your fertility. Avoid sedentary lifestyle. Managing your stress level can also increase your chances of becoming pregnant. Being either underweight or overweight reduces your chances of also becoming pregnant. So you need to do something about it. And I want to bring it to your notice that the more antioxidants will give you higher chances of getting pregnant as a woman. And where do you get the antioxidants? In these wonderful supplements. Well, you will talk to somebody who will have shared with you, especially from the Visionaries team. When anyone shares with you this link, just know they will guide you on what to use. You can talk about 24/7, talk about complete, talk about Coledus, talk about the living alkaline coffee, talk about Angel E, and what is the major role of most antioxidants in getting pregnant. Mega anti-aging property to delay menopause. I've seen people failing to conceive because they get into menopause early. Then the other one is increased collagen for healthy body. Then they support healthy menstrual cycle. They prevent hormonal imbalance, lower cholesterol levels, prevent against heart diseases, including hypertension. Then they prevent cancers, including cancer of the cervix, control blood sugars, enhancing and nourishing and strengthening and balancing the immune system, enhance the sexual vitality in both men and women. They protect your precious DNA and RNA. More important, they prevent tumor growth. They even prevent fibroids and cysts. Those are antioxidants. So basically, as I come to the end, before I get to the end, I want to send greetings to all the Visionaries team. Thank you very much for making sure that these programs keep going. But I want to share with you a story of Madam X. Here she is. We've helped very many people, but not anyone would be comfortable with you sharing their stories. But Madam X here, before that was, she's a proud mother who had a daughter who was around 16, 17 years, but she was going through hell. She used to have a lot of discomfort, enlarged tummy, too much pain, continuously bleeding day in, day out. What was her issue? She had fibroids. And actually, these are her medical forms. Fibroids take different forms, or there are different types of fibroids. A fibroid can go to the extent that it can come out vaginal as a woman. And what did she go through? She used to have that lower abdominal pain, frequent urination, pain during sex, lower back pain, constipation, chronic vaginitis. It could not be you, but you may find there is somebody suffering out there. You need to help them out. She even used to have miscarriages, but courtesy of these wonderful products that I've shared with you as antioxidants, and with much focus on C24/7, the best antioxidant on the world market, she was able to be helped, and she got the fibroids out. But more importantly, she was able to conceive and carry a baby to term. And this was the year in 2020 when she was celebrating a baby shower. Look at her. That is her firstborn at the back, but here comes the secondborn. That is how powerful these products are. That is how powerful antioxidants are. You could be battling any condition. You have different testimonies. These are ladies who had fibroids, who had disease, but they are doing well. Just like not everyone will be comfortable with you sharing their pics, but these are very okay with it. Now, other things that I want to talk about, cancers. These products are able to help you. You can even also talk about diabetes. These products are in position to help you on different conditions. Then talk about goiter. That is before and after. So basically, life comes to an end. You need to understand, yes, life comes to an end, but do something about it. You need to take care of yourself, or else you're going to lose your life before it is yet to be lost. I want to thank you very much for following us at HBMS TV. In case you have any questions, you can always reach out to us. You can even comment down there in the comment section on our channel, and we will be in position to answer all your questions. Thank you very much, and may God bless you. HBMS TV, talking health.